I wanted to cover today what the report of findings are. In chiropractic medicine, the report of findings are actually what you present to the patient, your findings, and what the plan of treatment is. So through the years, I didn't really like explaining the whole bone on nerve model that chiropractic uses. So I used the load capacity model. And this will help to explain how Electrons Plus actually fits into a practice. Okay, so when a patient comes in, first they're usually in pain. So after I evaluate them and do some testings and so forth, I'll sit down and explain using physics on why they are experiencing pain. So we have a balance issue here with load and capacity. Load is what you do to your body, how much you lift, stress levels, workouts, etc. So load is the amount of force you produce into the tissues, namely tendons, ligaments, joints, and muscle. Okay, so capacity has to do with your body's ability to deal with that load. The stronger you are, the more load you can put on the tissues and you actually stay in balance. So once somebody comes in, they're usually out of balance and they've overloaded the tissue somewhere, and this equals pain. Okay, so in your history taking, all the questioning is designed to find out where that load is coming from and what tissues are being overloaded and causing pain. Okay, so your traditional history taking is, when does it happen? How did it happen? Can you actually reproduce that pain in the office? It hurts when I bend over and so forth. So in your mind, you're actually creating a hypothesis of what tissues that you need to check. Okay, so when you find, say, a patient, it hurts when they lift or squat or whatever, you have to give the body time, give those tissues time, so you have to unload that, okay? On the capacity side, mostly has to do with your muscles. Okay, muscle fibers, they run like that, and when they contract, they generate force. Let's say healthy tissue can generate 100 pounds of force. Okay, when you have repetitive strain injury, high force injuries, you'll develop scarring in the muscles, okay? And over time, that scarring will start to bind up and produce a knot, an adhesion, whatever you want to call it, okay? So now those fibers are kind of bound up, and now the filaments can't slide to generate the same amount of force. So let's say in this scenario, now it can only generate 50 pounds of force. So your capacities drop from 100 to 50, okay? So what we have to do in this equation is unload the tissues and then treat the tissues and try to get this back to normal, okay? So when we look at the muscular system, muscles are basically pulley systems. You have the muscle, which is the rope. You have the weight, which is the bone, because muscles attach to bone. For example, your bicep, when it shortens and contracts, it raises the bone, okay? So most of the time, when you have this, it's equivalent to the pulley being rusty. That muscle, you have to yank on that muscle harder to do the same amount of work, okay? So usually when you go to, let's say, physical therapist, if you go in with a shoulder issue, they're usually going to tell you that the rotator cuff is weak, or if you have a back issue, your core is weak. And what they normally do is they give you a set of exercises to strengthen. So what they're initially asking you to is, let's pull on this harder, okay? So we're going to yank on this harder. More exercise means more load, so you actually take it into the wrong direction, okay? So in this scenario, what's better is to apply some WD-40 to smooth out the pulley So it's easier, so the muscle doesn't have to work as hard. Okay, in the human body, it all boils down to adhesions and not myofascial restrictions. So what we do is we actually want to iron this stuff out. Okay, so whatever technique you use, you know, in my office, it's ART, fat tools or Graston, myofascial release, fascial manipulation, foam rolling at home. All these techniques are designed to grind down that tissue. Okay, so the next question is, once you grind down that adhesion, what's happening to the muscle? Do we have a technique that actually treats or lets us know how the messaging center is, the brain and the messaging, the signaling to that muscle? Do you have a technique to evaluate this? And that's where Electrons Plus comes in. AK, QN, all these different techniques, laser work, exercise to a certain extent, you're actually strengthening that pathway. Okay, so when you have Electrons Plus, you can diagnose the problem here. So when we actually send that signal through, we can run the PEMF through the tissues, and healthy muscles will contract. It will twitch, and unhealthy won't. If you compare the healthy side to an injured side, it will totally feel different. Okay, so when you send that signal through and it doesn't contract, you know that something is blocked here. If you're a neurologist, you're going to say nerve flow is blocked. A chiropractor, nerve flow is blocked. If you're an acupuncturist, it's chi or prana, whatever you want to call it. This signaling is not healthy. Okay, so in your practice, to be a well-rounded practitioner, you should incorporate different tools in your toolbox, whether it's nutrition, exercise, lymph drainage, okay, neurology, and the list goes on and on. Okay, but Electrons Plus, what it does to the cell, if you have damaged tissue in the cell, it will increase ATP production. When that cell has more energy, it can work better. It can produce collagen, anti-inflammatories, replicate, lay down new cells to heal. In practice, what you're going to see is bruising heals so much faster. Why? Because the PEMF will increase microcirculation and it will get things to heal so much faster. So if you look at all these modalities, let's say nutrition, how can PEMF work with nutrition? Well, PEMF, it will open up the cell membrane, and if you do an IV of nutrients or supplements, it will get into the cell a lot faster. Exercise, you can reactivate certain muscles. As I told you, if you guide that and it doesn't contract, then your exercise is not going to be as effective. So you can combine this with exercise. Let's say rotator cuff. You can point to some of the rotator cuff muscles as your patient is trying to exercise. Okay. Lymph drainage. You can do like a Swedish massage with the PEMF, with the guided PEMF through the tissues, and be very specific in what areas you want to address. And then anytime you have hands-on work, you are choosing any one of these techniques, you're doing a lot better job. You're not doing extra work, you're doing the same movements, but you have that extra magnetic field run through your hands, thereby stimulating. Okay, and you're also going to work the brain signaling. Okay, so multifaceted. If you combine the guided PMF into any practice, depending on what techniques you do, as long as they're hands-on techniques, you can upregulate all these systems. Okay, so that's how powerful. And then if we can diagnose, so some of the other PMF devices out there, on the low intensity side, you're looking at Beamer, IMRS 2000, the mats that you lay on, and you basically charge a cell. They do a great job. But if you have a person who is injured, do you want to charge them with a trickle charger, or do you want to boost the whole level? On the other side of the spectrum, you'll have MagnaWave, pulse centers, the coil system. Great job there too, for more of an unattended, but what's the problem there? You don't get specific. If you have a shoulder issue, you're gonna wrap the coil around the shoulder, okay? But using Electrons Plus guided PMF, you can actually show somebody where your deficiency is. You can diagnose unreactive tissue. You can show the patient will feel and see the difference between healthy tissue and unhealthy tissue. And then you can kind of start to see the progress. Okay, so I wanted to outline where Electrons Plus fits into a manual medicine or a physical medicine type practice, massage, physical therapy, chiropractic, and we get valuable information with the diagnostic work and then combining it with manual therapy techniques. Okay, so if you have any questions on that, please comment below. And so load capacity, dealing with tissue, adhesions in the tissue, and then grinding that tissue down with manual therapy techniques, as well as getting the signal of the problem taken care of. Okay.